Hello, everyone. Thank you so much for being here today with us. My name is Emily Vorty, and I am the White House's Associate Director for Disability Engagement in the Office of Public Engagement. It is so phenomenal to be with you all today, our friends in Utah, talking about the implications of home and community-based services in additional funding for your communities, both as self-advocates and those providing care. So we are so thrilled to be here in partnership with the Utah Council for Developmental Disabilities, as well as the National Association of Councils for Developmental Disabilities. So thank you all for being here with us today. Without any further ado, I want to introduce our very first speaker, who's going to provide some framing for why we're here today and why this conversation is so important. So I'd like to introduce Alison Barkoff. She is the Acting Administrator and Assistant Secretary for Aging with the Association for Community Living here in the Biden administration. So thank you so much, Alison. I'll turn it over to you.
Great, thanks so much, Emily. And as Emily said, my name is Alison Barkoff, and I am the Acting Administrator and Assistant Secretary for Aging at the Administration for Community Living, which is an agency in the U.S. Department of Health and Human Services. And ACO's mission is to ensure that all people with disabilities and older adults have the opportunity to live, work, and fully participate as valued members of their community. And I really want to thank one of our grantees, the Utah Council on Developmental Disabilities, as well as the National Association for Councils on Developmental Disabilities, for pulling together today's event, and for Emily giving me the opportunity to just frame out briefly a few comments about the President's Build Back Better plan and its proposed investments in home and community-based services. I know I don't need to tell all of you the importance that so many people with disabilities and older adults need access to home and community-based services to be able to live, work, and fully participate in their communities. But for too long, too many people have been unable to access those services. More than 800,000 people with disabilities and older adults are sitting on wait lists for community services across the country. And at least based on the latest data I could find in Utah, more than 3,000 people are waiting for services. And this lack of services has incredibly dire consequences, forcing people into nursing homes and other institutions and placing others at risk. COVID-19 has absolutely laid bare the risks of institutional and congregate settings, with more than a third of the deaths occurring in institutions. And throughout COVID, we've seen the importance of community-based services. So many people lost access to services and supports, requiring families to take on caregiving responsibilities, causing people to have to leave work or reduce work. And many people with disabilities were completely socially isolated. Even before COVID, there was a crisis in the direct support workforce, with too many people who are essential workers not being treated as such. So where does that bring us? The one silver lining of COVID has been that it has created an absolute national urgency like never before to expand community-based services, strengthen the direct care workforce, and support family caregivers, what President Biden has called the caregiving infrastructure. We've already seen incredible action by the administration working with Congress to take some initial first steps. And in the American Rescue Plan that was signed into law in March, more than $12.7 billion went to expand states' home and community-based service systems. It's a start that helps states do things like expand community services, address the needs of people on waiting lists, transition people back from institutions to the community, to start addressing the direct care workforce through increased pay and benefits, recruitment, and training. And this is really an unprecedented opportunity for all of you to work together to push forward priorities in Utah. President Biden has been absolutely clear that the funding in the American Rescue Plan was just a down payment, and that we truly need significant investment to address the caregiving infrastructure in this country. That's why the president's Build Back Better plan includes $400 billion investment in states' community-based systems, expanding and supporting the direct care workforce, and supporting crucial family caregivers. It also proposes to permanently reauthorize the very successful Money Follows the Person program, which has helped transition over 100,000 people out of institutions back to their own communities. Just last week, Congress started moving forward on the president's caregiver plan. We've seen bills introduced in Congress, like the Better Care, Better Jobs Act, which has this $400 billion investment, as well as the Supporting Our Direct Care Workforce and Family Caregivers Act, which would provide an additional $1 billion to put in place infrastructure and strategies to strengthen the direct care workforce. Just last week, the Senate took its first important step in moving forward this, what we call the soft reconciliation bill, through the reconciliation process. I'll end by saying, if this bill passes, and we are pushing hard in every single way, it would truly be a game changer. It would fundamentally change the way people with disabilities and older adults access long-term services and supports, and make community living a reality for so many more people with disabilities and older adults. After decades of, at best, slowly chipping away at the institutional bias and growing wait lists for home and community-based services, we are on the precipice of what is truly a once-in-a-generation opportunity. It's been incredible to see the disability, aging, and labor communities come together to support the Build Back Better plan and its home and community-based funding. I can say from my many decades of being a disability advocate that everyone here has an important role. Sharing your story is the most important way to impact policy. Sharing about what this funding would mean to you, to your family, what it's been like for those of you who have sat on wait lists for services, and the difference that it's made in your life to be able to access community services. For those of you who are direct care workers, sharing your experience, your commitment to the job, but the many, many barriers you face is so crucial. And with that, I'm going to turn it back to Emily, because again, sharing our stories like we're doing today is the most important way that we can have an impact and really, hopefully, make a huge change together. Emily?
Thank you so much, Alison. I really appreciate your time today and your framing for just getting us started on why now more than ever this investment is critical for our nation and for the state of Utah. So I want to introduce our first storyteller, Lisa Wade. Lisa is a parent of an adult child with a disability, and also is very closely involved with the Utah Parent Center. So thank you so much for being with us today, Lisa.
Thank you so much, Emily. I am honored to be here. As was said, I do work at the Utah Parent Center, our state's parent training and information center. And as part of my job, I talk with a lot of families, some of whom have loved ones receiving services and some of whom are on the wait list for services. And in doing so, I've heard some very heartbreaking stories from some of these families who are languishing on that lengthy wait list. Their families are in crisis mode and falling apart, and parents don't know what to do. And so they begin considering putting their loved one in an institution, not because they want to, but because they can't see any way forward without any additional help coming to them. I also have talked to families who have parent has quit their job or are planning to quit their job when their loved one exits the school system because they don't have any way to care for their loved one during the day if they continue working. So I know firsthand that HCBS funding really strengthens and supports families. I know for us, that break that we get every day from having to care for our son really helps me to recharge and rejuvenate physically, emotionally, and mentally, so that when he comes home, I am much more able to be patient and to have resilience when caring for his extremely high support needs every day. I know that HCBS funding also strengthens and supports our community. My son and his groups are out in the community all day, which helps our communities be more inclusive. One of his providers has made partnerships with some community businesses and agencies to offer classes and activities for their clients. And of course, as groups, they patronize local businesses, thus building the local economy. But most importantly, home and community-based funding strengthens and supports the individuals that they serve. My son has such a good quality of life where he's able to make choices about what he does each day, where he goes, and he's able to build on those skills that he spent 19 years in public education gaining. Rather than staying home and losing them, he's able to practice them out in the community. He's able to practice appropriate behavior while out in public, to negotiate and communicate with his peers about what they want to do for the day. And he's been able to volunteer in the community and have a competitive job. And it's all because of the HCBS funding that he has received. So to recap, I just want to say how important HCBS funding is, not just for the individuals that they serve, but also for families, and strengthens our communities. And thank you so much for allowing me to share my story with you today.
Thank you so much, Lisa. Next, I want to introduce Amberly. And Amberly is a parent of a 9-year-old that is currently on the waiting list. She's also a staff attorney at the local PNA in Utah. So Amberly would like to introduce you, and thank you so much for being with us here today.
Thank you for giving me the opportunity to speak today. My name is Amberly Datillo, and I'm an attorney at the Disability Law Center, the protection and advocacy agency for the state of Utah. Our mission is to enforce and strengthen the laws that protect the opportunities, choices, and legal rights of people with disabilities in Utah. I work on our Olmsted community integration team to advocate for the full inclusion of people with disabilities across the lifespan into the larger community by promoting comprehensive, quality, community-based services as an alternative to institutional care. This work is really personally meaningful to me, as I have a 12-year-old son named Isaac, who is autistic and on the waiting list for waiver services here in Utah. Isaac is really funny and kind and loves science. He tells me that when he grows up, he wants his own apartment and a cat and to study chemistry. And then he also always lets me know that he doesn't want to be a lawyer like his mom. But particularly when he was young, Isaac had really complex medical and behavioral needs. There was a point when his support team suggested intensive services so that he could avoid an institutional placement. At the time, we didn't qualify for traditional Medicaid. The waiting list for Medicaid waiver services was decades long. Our private insurance did not cover the services that we needed, and we definitely couldn't afford to pay out of pocket for those services. It actually took a member of my extended family who paid more than it cost for me to go to law school, and then eventually a move out of state and a move for a new job in order to get Isaac the services that he needed. We were really lucky, as I know that many people in this situation have not had these same opportunities for their children. I want for Isaac what I want for my other children when they grow up: to have community, to spend time doing things that he finds meaningful, and to live as independently as possible. He will need Medicaid waiver supports in order to do these things as an adult. Through my work as an attorney, I have the opportunity to talk with many people with disabilities, both those living in institutions and those receiving waiver services. And I find that their dreams are similar to those of my son. I talk to people who want to leave institutions. I talk to people who want to live closer to their families and the people that they care about. I talk to people who want to work in the community. I talk to people who want more freedom to choose what they do and who they do it with. I talk to providers who need more funding to adequately provide these supports. Unfortunately, I also talk to people who have been abused or neglected while residing in institutions. And sadly, I now talk to family members of people who died from COVID-19 while residing in congregate long-term care facilities. Community services are life-changing, and as the pandemic has demonstrated, life-saving as well. When the Americans with Disabilities Act was passed in 1990, disability rights advocate Justin Dart said that the clear promise of the ADA is that all people with disabilities will be fully equal, fully productive, fully prosperous, and fully welcome participants in the mainstream. Keeping the promise of the ADA is not going to be easy. As an advocate and as a person, a parent of a person with a disability, I want to ask you to help keep the promise of the ADA by providing access to quality community-based care. People should not have to choose between waiting decades for services or having to live in an institution. People who have waited for community services should receive services that are truly integrated and markedly different from the segregated and congregate institutional care they would have immediately received in an institution. The Centers for Medicare and Medicaid Services in the states should ensure that the settings rule is meaningfully implemented to improve the quality of waiver services. We need to adequately fund providers and particularly direct support workers who provide these important services. Thank you for giving me the opportunity to talk about this important topic.
Thank you so much, Amberly, for your work and your mentorship and your support in this space. Next, I want to turn it over to Joey Hanna, another one of our storytellers. Joey is a direct service provider, works to support those receiving home and community-based services. She also works closely with parents in crisis or those who are waiting to be pulled off of wait lists. So Joey, thank you so much for being with us here today.
Thank you, Emily, and thank you so much to the speakers who have gone before me and sharing their story. As Emily said, my name is Joey Hanna. I am the executive director here at the Utah Parent Center. We are the organization that provides the Parent Training and Information Project, as well as the Family Voices Project here in Utah. And so in my role here at the Parent Center, I have an opportunity to work with families across disability spectrums, as well as families families that are waiting for services, families that are receiving services. And as a matter of fact, all of my staff are made up of families who are in one of those two categories. And so today, the story that I want to share is really the story of the staff members that work with me and that I get to share my time with and who serve our community in our peer-to-peer network as parents of kids and young adults with disabilities, who share their talents and their expertise and their experiences with all of the residents here in Utah. And I want to talk for a minute about the fact that some of them who have kids that are waiting, adult children who are waiting for HCBS services, unfortunately will not be able to work for us and do the good work that they're doing after their kids age out of school because they don't have any other opportunity. They don't have any other options as they sit on the waiting list. And so I find it a tragedy that we will lose them in the workforce. Their talents and their skills help so many people. And I think that that it's an absolute travesty that we have so many families that make up this huge, massive, unpaid workforce in our country, people that could be working and contributing in our community, but unfortunately have to stay home in order to take care of loved ones. And in a lot of cases, we see the sad reality that a lot of people are unable to participate in the community simply due to the fact that they don't have the resources necessary to do so. And so the proverbial cliff of graduating and leaving post high and having nothing to do is unfortunately a reality because HCBS services need more funding. And so I am happy to be here today to be able to support and to advocate for and ask for support for this community. And I appreciate all of your work so much. Thank you very much.
Thank you so much, Joey. I so appreciate your participation today. I want to kick it over to to Kelly Holt, who is a self-advocate living in Price, Utah. Kelly, I'll let you take it away to tell your story.
Thank you very much. My name is Kelly Holt. I live in Price, Utah. I live in the rural area. My service provider lives in Spanish Fork, which is about 1 hour away. My staff lives about 10 minutes away from me. I have service since 2011, and I have had a coordinator the whole time. I signed up with my provider, Scott, around 2016. My day staff has been with me for 3 years. The waiting list is very important to me. I was on the waiting list for 10 years. It is hard to be on the waiting list because my family has to take me to work and the store and other places. Now I get to do what I want and when I want to do. My staff takes me to doctors, grocery stores, run errands, and take me to my family member's house. I stay with my sister overnight when she uses a scooter and a wheelchair. My staff stays with me for part of this time so I could help my sister. It would be hard to do all these things if I didn't have the staff to take me. They are trying to help me stay independent and do what I want to do. I just signed up to be a substitute crossing guard. My friend helped me find out a job where available. My staff name is Cherokee. Will go with me if I get a phone call to substitute at one of the grade schools. I have to balance my costs each month with my allowed funds and the rules. My staff helped me figure this out and do not take advantage of me. I do get frustrated because I have a monthly spend down to keep my Medicaid. I have worked hard to learn to be an advocate while I was on the waiting list. I serve on the board for Disability Law Center. I also work with the Center for Persons with Disabilities. I am still an advocate, and now I am helping the DSPD with their committee. I joined the Speakers Network to do advocacy. I still do that today. Thank you for listening to us. I appreciate that. And thank you for taking the time to spending time with us today. Thank you.
Thank you so much, Kelly. Next, I want to introduce Lilian Llanos, who is a direct service provider in the Utah area, specializing in trauma-informed care. So Lilian, thank you so much for being with us. I'll let you share a little bit about your experience and your story.
Good afternoon. My name is Lilian Llanos, and I live in North Ogden. I have a 10-year-old son with Down syndrome. It seems that it was just yesterday when he was born premature at 33 weeks old. Immediately, my plans of going back to work just after his birth, a few months after his birth, were canceled, and that would be extended even longer than I could even anticipate due to his fragile health. I was forced to resign to jobs several times during his first years of life, which put our family in a very financial challenging situation. It was very hard to find reliable and qualified childcare for his specific needs and qualified care that we could actually afford. In 2018, when his health seemed to improve considerably and be stable, I once again went back to the workforce. But only a couple of months later, we were advised to schedule a tonsillectomy to fix sleep apnea. During this procedure, the doctors found out my son needed open heart surgery to fix a heart defect that was threatening his life. Once again, I have to give up my career. And due to the nature of the emergency, we were at that time we're very fortunate to be granted a one-time respite benefit through DSPD. That was a true blessing, especially because at the time I was also going through a divorce. Before the birth of my son, I was always a hard worker and contributing citizen, and this still continues to be one of my most important goals. Since the pandemic hit, the likelihood of me doing so has been threatened, although I have the blessing to work for an organization, the Utah Parent Center, that understand the challenging situations families with children with disabilities go through. Last year, you know that once the pandemic hit, the number of families facing health crisis multifolded. Probably my family crisis can't be compared to the level of needs of other families. And instead of having emergency respite funds increased due to this drastic change, the funds were reduced to zero. DSPD, as I understand, hasn't received funding the last 2 years. Also, as a parent consultant from the Utah Parent Center, I witnessed day in and day out the struggles that other families, these families, face. So that's the reason that I am here to support this plan that will allow for families to receive caregivers compensation or respite services. In the long run, no matter what is the benefit, that's going to translate into a better mental health. That's how I feel. And that in turn will allow me to become a better employee and mother and provider. And I know that it's the same case for hundreds, if not thousands, of families within the state. Thank you for listening today and for having this opportunity to voice my personal experience.
Thank you, Lilium. Our final storyteller today is Chris Larson, and Chris is the executive director and founder of Ember Services in Sandy, Utah. And he's going to tell us a little bit today about his experience as a community leader and direct service provider. Chris?
Awesome. Thanks, Emily, and thanks to everyone who brought the summit together, and for those who have spoken before me. Like mentioned, my name is Chris Larson, and I'm a small business owner. I employ 32 people, and we provide home and community-based services here in Utah. Providers like mine, large and small, collectively employ thousands of caregivers, nurses, behaviorists, office staff, entry-level management throughout the great state of Utah. Personally, I got my start in this profession in my early 20s at a summer camp for kids with disabilities. I remember seeing the job posting for a day camp counselor and being excited and surprised that something this meaningful and fun was real. I was hired on, but quickly struck at how much work the job required. We were physically on for 9 hours a day. We kept these awesome kids having fun, doing meaningful activities, while also making sure they had the assistance to eat, take their medications, assist with toileting, and tackle their very challenging behaviors. I honestly wasn't sure if I was going to make it through the first week, but the more I did the work, the more I fell in love with it. As we built relationships with each of the kids, we were able to support them in the way they needed. The job became more manageable and also so much more meaningful. And by the end of summer, I was hooked and found the work I would dedicate my life to. Over the next few years, I served in various leadership roles, learning the ins and outs of group homes, day programs, foster systems, and family services. I learned many things serving clients directly and supervising programs. One of those being, people with disabilities do best when they are able to have the same experiences as their non-disabled peers. No one is asking for special treatment, just accommodations and support to pursue the American dream and happiness like everyone else. Second, families benefit from services as much as the individuals receiving support. I have seen couples who were exhausted and at the end of their ropes. Through paid support, they were able to find hope and healing within their family by having time to focus on all aspects of their relationships and give time to the whole family. Watching couples fall in love again when they have the time and energy for each other is powerful. Another major lesson I learned is that consistency in staffing can be the biggest factor in people reaching their goals. Creating a system where people want to stick around and can afford to live is crucial. As a small business owner, one of the most fulfilling parts of employing these amazing staff is that it not only gives them purpose and meaning in their current job, but often sets them on a path to train for some of the most needed jobs throughout the country. As providers, we have seen our staff go on to become teachers, nurses, doctors, caseworkers, therapists, along with many other vital careers that each and every American rely on. As providers, we are currently working on shining a light on the fact that our rates often limit us to pay the wages that are below the effective minimum wage. Many providers are forced to pay $11.50 to $12.50 an hour for direct support professionals. These staff are expected to be responsible for the lives of very vulnerable children and adults. It is hard to recruit reliable and trustworthy people when many of the fast food places in our area are advertising starting wages of $15 an hour. We support fair wages for all people, but the immense responsibilities of this profession justifies a higher wage than the average entry-level job. I strongly believe that as we work together to strengthen the home and community-based waiver system, we will not only better the quality of lives for people with disabilities, but we will be offering high-quality work to Americans who are looking for a job that provides purpose and pays a livable wage. Thank you to everyone on this call committed to making this happen. Thanks, Emily.
Thank you, Chris. As we wrap up, I want to introduce two of our leaders that helped pull this call together. So first, Erin Prangley, who is out of the National Association of Councils for Developmental Disabilities. Erin, if you want to jump on and just tell us a little bit about yourself and your work at NACCD.
Thanks so much, Emily, for the introduction, and greetings everyone from the National Association of Councils on Developmental Disabilities. Located in Washington, D.C., NACDD advocates for the 56 state developmental disability councils before federal agencies and members of Congress. It's a really exciting time here in Washington, D.C. For decades, advocates such as myself and others have, and Alison Barkoff, before she was elevated to work at this administration, have pushed so hard for Congress and different presidents, Republicans and Democrats, to understand why we need community living for people to live their fullest lives, and how that was only possible through a strong and strategic investment in home and community-based services. A little more than a year ago, candidate Biden developed a comprehensive plan for disability rights and inclusion. And anchoring that plan was a commitment to the investment in home and community-based services. This was quite remarkable. It was the first time in my professional career that I had seen a plan detailed enough and informed enough to understand that without these services, the civil rights of people with disabilities would never fully be realized, as was intended by the Americans with Disabilities Act and the Olmstead Supreme Court decision. But even more remarkable, just this year, we saw the plan put into actual legislative language and a roadmap that you've heard people talk about called the Build Back Better plan. And members of Congress are actually working on this and on board, but this won't happen unless we have the full commitment from those of you in the states, especially the great state of Utah, to educate your elected leaders and your friends and your family about why we need their support now to make sure this historic investment is pushed through. You know, the Build Back Better plan was developed by people who really get what community living and inclusion means. This includes people with disabilities themselves. The administration worked with people with disabilities and many advocacy groups to make sure that this plan had the best ideas, including better pay for people who work with us, our direct service providers, but also expanding services and including more people so that they can not only end the waiting list, but make the services that people already receive more flexible to best meet their needs and satisfy the need for self-determination among people who are actually using these services. I just want to say that, Alison said that $4 billion with a B would be used to invest in these services. And that's the amount we need because that's the need. The need is great for people to live their greatest lives in the community. The Build Back Better plan is a way forward to make the changes we need so people with disabilities can have their civil rights and live their fullest lives in the community. I want to thank all of the tremendous speakers today for coming forward. We need more speakers and more stories. And I also want to thank the strong political leadership of the White House and the Utah Council for bringing this meeting to all of us, and urge all of us on the line to stay in touch with the Utah DD Council. These are the folks, once we get this plan through Congress and through the White House, I'll be working closely with the Utah Council to make sure that the great state of Utah takes advantage of the new and expanded services promised under the Build Back Better plan. Thank you all so much for your activism, and thanks again. Back to Emily.
Thank you, Erin. I cannot echo enough just how grateful I am for all of our storytellers today for coming together and sharing what this funding has and could mean for them, both as service providers, as parents, and as self-advocates. Before we close it out, I want to pop over to our final voice, our leader here in Utah, Libby Aseguro, who is our director of the Utah Developmental Disabilities Council. Libby, thank you so much for your leadership in putting this meeting together, and I'll let you take it away here to close us out.
Thank you so much, Emily. And I really want to extend the sincerest thank you to everyone who showed up today to share their stories and all the unique perspectives today. It's immensely valuable, and I really appreciate the support of Alison Barkoff for being here, demonstrating support for this very important community. And I also want to thank the valuable partners that we have at the National Association of Councils on Developmental Disabilities, as well as the White House Public Engagement Office. And there were several other people who coordinated this event. I feel like I'm on an award show here, so I'll wrap up the thank yous, but I really do have a huge amount of gratitude for this opportunity and for everyone who came forward today. We are extremely grateful that the Biden administration has made this a priority to expand access to home and community-based services. Policies like the Better Care, Better Jobs Act and other recently introduced policies to provide more support to direct care professionals and to caregivers. These are the mechanisms that are going to bring President Biden's vision to create more jobs and better access to critical services and supports that foster both integration and independence, and then lead to better pay and benefits, ultimately all improving quality of lives for all Americans and especially Utahns. Again, my name is Livia Segura, and I am the Executive Director of the Utah Council on Developmental Disabilities. It's the mission of our council to support and empower people with intellectual and developmental disabilities to achieve both inclusive and meaningful, as well as self-determined lives in the communities that they live in. And we do this through ongoing support of leadership, education, policy, and advocacy actions. We are an independent governor-appointed body, and the UDDC has representation across administrations as well as individual and family voices. It is a huge responsibility of our council to educate and inform both state and federal legislatures about the needs of people and families experiencing intellectual and developmental disabilities. As you heard from our speakers today, and as we have heard from staff from countless other Utahns, home and community-based services are vital, yet undervalued. And tragically, too many people are waiting way too long. Thousands of eligible Utahns with disabilities are waiting for services. Without action on this issue, it's likely that they will wait for 5 years or more. And we at the UDDC have learned from stakeholders that there's just not enough information about the issue related to HCBS in the hands of decision makers. This includes lawmakers, stakeholders, and even families and individuals don't have the tools that they need to properly support this issue. I'm fortunate to live in this great state of Utah, where our disability advocacy community is really strong and coordinated. And I know that together we can all work to educate the public about this issue to make sure that we keep moving forward. I urge you today to contact your congressman and talk about your experience as it relates to home and community-based services. Your voice is the greatest gift you can give. We encourage you to share your story and to educate decision makers about the value of diverse and integrated communities and about the wonderful place that Utah is to live and how we can strengthen that by making sure that we have full and inclusive communities. So thank you again to everyone that participated today, and I really appreciate this opportunity.
Thank you all. Thank you, Libby. This concludes our time together today. Thank you all to those who have tuned in. Continue to tell your stories, share your stories, amplifying this issue. We'll hope to see you again sometime soon.